All right, Erika, welcome to Political Hope.
Hello, thank you for having me.
Thank you for showing up, and not just showing up in the way that you do for the work you do, but also for you for showing up in this space and for having a potent conversation around whatever this hope that you're planting is.
Well, I am so excited to be here because this fight to have single payer healthcare, also known as Medicare for all, has been going on for over 100 years.
Wow.
Teddy Roosevelt, if he had been elected to a third term, he was going to push this in his presidency, which he was not reelected. And so it's been a long fight. And I've been thinking about this. And part of what gives the opposition even more fuel than all their money and everything that they have like that is for the people being in the dark about what is single payer. And so coming onto your show helps us bring light to this, to the facts and to get it out there. And so thank you for making the time to have me on here to talk about single payer healthcare.
Of course. I mean, of course, I have my blind spots with this as well. So I want to learn and understand this because there's been so much you don't know what is true and what's not. But before we get there, Erika, I'm curious, what is your take on political hope? Like, what does that mean to you? What does that feel to you? How does that show up?
Yeah. I was actually thinking about this yesterday. So how political hope shows up for me, where I get political hope from, is the activists on the streets doing the work. And so when I say that, I'm thinking about Dr. Melina Abdullah with Black Lives Matters Los Angeles, Black Lives Grassroots, where they were just in Tampa, Florida, last week and the week before, giving court support to the family of Andrew Joseph III, who was 14 years old when he was killed by actions of the Hillsborough County sheriffs. And
so they went to Tampa to support from LA. And
yeah.
mind you, let me differentiate here. Like, when you say Black Lives Grassroots, Black Lives LA, there are, just so the listeners understand, there are different organizations that are part of Black Lives, because there are some Black Lives Matter, like the major one got caught, like siphoning money and whatever. So there's some shadiness there too. But this one you're talking about, they're like more they're like actually hands on with helping community. Is what I'm thinking.
Yeah, so thank you for bringing that up. So you're referring to Black Lives Matters Global Network Foundation, and that was created as an administrative arm to kind of help facilitate funds to the local chapters. So like Black Lives Matter Los Angeles is a local chapter. Black Lives Matter Atlanta is a local chapter. And what happened is, yeah, the issues were happening with that global foundation. And so I have been being an allyship with Black Lives Matter Los Angeles through another amazing organization called White People for Black Lives.
Oh, wow.
And I have been on the streets with Black Lives Matter Los Angeles since 2017.
Wow.
So, I mean, not that long for me, but it is the local organizations. And then together they're kind of like Black Lives Grassroots. They are the ones that are in the streets. They don't get paid. These are all volunteers.
They're like mutual aid. They're mutual aid too. Like, right?
There's a lot of mutual aid. And one of the things that they do is show up for court support when these families are, finally have their day in court, if they do, which is obviously very distressing. And so, yeah, when I think like, and so the Global Foundation, they've never done anything. Like, I don't know.
Why am I not surprised, Erika, that an administration or like management is like failing? Like this is like a pattern I'm seeing all around the US, all around the world, like where the administration, the management, they're the ones who are the most corrupt. Like they're like corrupt, inept. I don't know which way to put it. I don't know how to like articulate it, but like consistently there's an issue with this managerial class where like they just don't know how to do stuff.
Well, that or whatever else there is, but yes, but it's like that. So thank you for making the decision. So Black Lives Matter Los Angeles, along with the other grassroots, which is the local chapters, Atlanta, I think Michigan, all, and again, these are all volunteers, all showed up to support Andrew Joseph III's family. And I just, so when I think about that, when I think of Sister Helen Jones, you know, whose son he was in Men's County Central Jail, and whose son was killed while he was in jail. His name is John Horton, over 10 years ago, and still they have not reviewed the case. When she finally, they tried to say that he committed suicide, and like when she finally got the autopsy report, yeah, I don't know how he could beat himself to death. But anyway, but when I saw like in 2017, Sister Helen Jones out there doing the work, not just to get justice for John Horton, but to prevent this from happening to other people's children, and looking right at me, even for my children, for my sons. I mean, these activists who are out there fighting. I was thinking yesterday about even when I think about Gina Viola, who ran as a mayoral candidate in this last primary election here in Los Angeles, and how she spoke such truth and said, yeah, we need to defund the police and refund the people. And here's what that looks like. And her calling out truth on the 4118, which is criminalizing people for being poor, not to mention that it's unconstitutional. And without, I mean, the backlash that she got, and she still stayed the course. When I think of, you know, podcasters and journalists out there, I'm thinking of Jimmy Dore, who tells the truth on every subject, no matter this kind of courage. When I think of, I was thinking my co-chair, Maureen Cruz, who has kept the single payer movement going in Los Angeles for decades, even when she would hold meetings and be herself and one other person. But what that did was, when Bernie Sanders came out with Medicare for, you know, popularized Medicare for all, which had been around with John Conyers in HR 676, which is now Pramila Jayapal's HR 1976. So it had, you know, so much love to John Conyers, who would reintroduce this year after year. But when it exploded on the national stage with Bernie Sanders, you know, I had a place to plug in. And this kind of activism, this kind of, I'm going to fight for this no matter how hard it is. You know, did you see the movie Deep Waters about, yes, right? The one lawyer who takes on DuPont. Are you kidding? Like, this is political hope for me.
Yeah, that's super powerful. I mean, it's Aaron Brockovich comes up, and there's that guy who went to Chevron. He went against Chevron out in and he's still dealing with them. Wow.
Yeah, the lawyer who went against Chevron, who is facing consequences. How about not too long ago, the scientists, right? I'm an activist, so I've been in the streets, but you think of like our scientists, that's not really their thing, who chained himself to a gas station here I mean, when you see, I mean, this is courage, and this is the fighting against all hope and still fighting, because there is faith that somewhere we will win. And, you know, I even think of like, the abolitionists back in the day of slavery and hundreds of years fighting. Well, you know what? Thank God they didn't quit.
Yeah, exactly.
So that is political hope.
That's amazing. I mean, in you sharing that, I'm getting like goosebumps because I'm contemplating that, we oftentimes kind of like resort and hope that that one person will show up, right? Or like as a society, we've kind of got into this thing where we're like, where there's a savior and like, oh my God, that person is awesome. And we deify that person, right? But we all have that inside of us. And when we come together with that shared vision and with shared values, we're so much more powerful. And like, for example, with what you're trying to do right here with healthcare. I mean, we're going to dive into this, but that's certainly something that matters to all of us, right? At some point, you're going to need some healthcare, right? Maybe you break a finger, or you need some medical attention, or your mom needs it, or your sister, or your daughter, or there's like, no matter what, you're gonna need some sort of service with health at some point. So it's something that affects all of us. But why? Like, I'm curious about this. Why don't we all care about that? Like, why don't we care? Like, why? What do you think is preventing? Like, what's blocking us from actually doing, like, proactively being involved? And what do you notice? Like, what do you notice about the pushback of why people don't think that this matters to them?
Not an easy question to answer. This gonna make me tear up a little bit, but I remember hearing a while back, somebody that they were in a very poor area of Appalachia.
Mm.
And these, like you said, we all need healthcare.
Mm-hmm.
At some point, sometime in our life, no one is exempt. Mm-hmm. And somebody was basically asking this question to the people in a very poor area, Appalachia, who desperately needed healthcare. And they came back with basically believing that healthcare is a privilege for those who can afford to pay for it, that it wasn't a human right, that you are worthy of just because you're a human. So if you can't pay for it, you don't get it. And they felt that they were just undeserving of it because they couldn't pay for it. And this is how propagandized our country is and our people are. So you're facing, it's, propaganda works, right? And so that right there is people not believing that they are worth having their medical, mental, physical, mental, emotional needs taken care of, unless they can afford to pay for it, rather than you're a human being. You deserve to have your physical, mental, emotional needs cared for by society. And, I'm actually going to just launch right into this because it's just perfect. This results from 4 questions, and I'm getting this. I love to give credit where credit is due. There is a doctor up in Portland, Oregon. I believe he's in his 90s now. I've never met him.
OG.
I'd love to meet him. His name is Dr. John Gaiman. He's an MD, and he's written these little pamphlets. I don't know if you can see if I put it up.
Oh, cool. It looks like Common Sense, like Thomas.
Yeah, and it's these thin little pamphlets. And of course, Maureen Cruz, my co-chair, who I talked to you about earlier, she gave these to me once for a Christmas gift. And I'm like, I love it. And he came out with several of these pamphlets called Common Sense. And this one is the case for and against Medicare for all, leading issue in the 2020 elections.
Wow.
But he talks about these 4 questions that every other industrialized country has answered, except for the United States. We have not answered these 4 questions. And the first one is, who is the healthcare system for? Is it for patients and families or corporate stakeholders in the medical industrial complex? Number 2, should healthcare services be not for profit or for profit as just another commodity on the open market? Number 3, is healthcare a human right or a privilege based on ability to pay? And number 4, what ethic should prevail in healthcare? A business ethic, maximizing revenue to providers, or a service ethic based on needs of patients and families? And like I said earlier, most advanced countries around the world answered these questions many years ago, some decades ago, a century ago, a long time ago. But the United States does not pose these questions to the public and has not answered them. And you can see, in our country, it isn't a human right. It is a privilege based on ability to pay. It is run with a business ethic about maximizing profit. The nurses, the California Nurses Association, CNA, they have a pledge, and it's called Patients Over Profits Pledge, that they want elected officials to sign. Put patients over profits. Our healthcare services right now are not about the needs of patients and their families. It is about maximizing profit for the insurance companies, for the hospital CEOs.
Oh, big time.
You're seeing we've watched our nurses go on strike for the poor treatment they are given. And why are they being given this poor treatment? Because the CEOs and the executives want to maximize their profit. So when the nurses have, 30 patients to look after instead of what it should be, and I'm making up these numbers, 30.
But they're supposed to be under a quota so they can actually give patients care. They can be present, that they could be attentive to the families. Like there's a reason behind that, There
is a reason for the states that are upholding that, great. Right. But for the hospitals who are ignoring it and be like, I'll take the fine because it's pennies in the billions that we're taking in. And so with single payer healthcare, this removes all these struggles from the nurses because, first of all, it removes the insurance companies, and basically it's removing profit from the system. When you have a single payer healthcare system, it removes the profit and it brings back the dignity to the doctors to actually practice medicine between themselves and their patients as they see fit, rather than an insurance middleman telling the doctors they can't do what they need to do. It allows hospitals to function as a place that is providing care and service, rather than let's fill up our beds, let's order these x-rays that we don't need to have, let's put more patients under nurses. It fixes all of these things. It doesn't, so this is, the big reason why we are supporting a single payer system, which removes profit out of healthcare.
Well, it's interesting to the significant research that shows that just the candor, like just the way that a doctor, I was just talking to my friend who's an acupuncturist, and he's also was sharing this recently with me, that just the candor that you show up and the way that you are present with your patients, just the connection, the relationship, asking questions, being curious. They've actually done research and showed that people start getting better. Like whatever illness they're experiencing, they start getting better before they've gotten any medication, got any prescription. They get better just because of the healthy relationship that's there. But if the incentive is, hey, you got to get through. I mean, I remember when I was in medical school, I remember seeing this, that it was a quota game. Like, it was like, you got to get the patients in and out, get them out, get them out. You're taking too long with the patient, right? And it's like, wait, that doesn't make sense. Actually, the relationship is a part of the healing process, right? The nurse being present with the patient is actually a part of the healing process. Like having somebody there touching you, knowing that you're going to be safe, you're okay. That's up, your cells respond, your immune system, your cardio, everything responds when you feel safe, when you feel heard.
You are so right. And that is part of the part of the healing profession, right? Doctors, nurses, physical therapists, you know, mental health therapists, right? They're all in the healing profession, and they are being prevented from doing their job in the way that they need to do their job by the insurance companies, by the, you know, administrators of whatever network they're in, because they are only interested in making profit for the shareholders. And how do they make profit? By taking in money and delaying and denying care. This in the health insurance industry, when they have to pay for patients' care, it is termed a medical loss.
That's crazy.
So we are like, Americans are paying, this is the only thing, Americans are paying for a service, like to buy health insurance, right? They're buying a product that they don't even get.
And the thing, the system is betting against them. Like, actually, like, it's like it's a gamble, actually.
It's not even a gamble. It's the house is completely set against them. You pay, you buy your health insurance with your premiums, right? So then you can't get the thing that you bought for, that you're already paying for, until you pay for your deductible, which I was talking on the phone to my insurance company, and I'm like, so here's my deductible. $400 per person in my family. There's 4 of us per year for in-network services. And this is where it gets up, plus an additional $1,000 per family member for in-network services. So basically that's $1,400 per family member for in-network services. And then there's $20,000 deductible for out-of-network services.
Wow.
I mean, so we're paying the premiums. We have to meet the deductibles before we get anything. If we go out of network, we don't get it. This
is not to mention the kind of like a chain, ball and chain kind of thing that gets connected to having to have jobs where you get insurance, so you keep the job even if the job is not fulfilling, even the job is taking advantage of you, even the job. And I've seen this with my parents, right? Like staying with jobs because they got these insurance policies, but the job is not in any way doing anything that's supporting the mental health, the physical health of the person working the job.
So this is another great point that you bring up, that having single payer, also Medicare for all, and then in California, it's called CalCare, which we can talk about, because we had a bill for California single payer, CalCare. It was written by the California Nurses Association. Go nurses. And it's going to be back, baby. So we are going to have a bill to rally around again. But this is
it on the ballot this November?
So it's not going to be on the ballot. It's actually going to be a bill presented in the legislature. And then the nurses are waiting to see what happens after the November elections. And then they're going to see who's going to author the bill. And then we'll take it from there. And then we'll be in the fight to pass this bill.
It feels like doing things by state might be more effective, because the general, like, it just seems Medicare for all across the United States is like, it just seems impossible. because it's so divisive.
So there's two theories where we are in healthcare for us, which I should say, I'm co-chair of an organization called Healthcare for Us, and the US is capitalized because it's a play on words, healthcare for us and
US.
healthcare for the United States. And so we are based in Los Angeles, but our mission is to pass single payer healthcare legislation here in the state of California, because California is the world's 5th largest GDP. So we have enough money to do it. We're a big enough state where we don't have issues of a lot of people living in the state, but working in another state and going back and forth home. And we have a governor who, when he campaigned to be governor in 2017, pledged that he was for single payer healthcare. Now, he did not help us at all with the last CalCare bill, but and we have a Democratic supermajority, which you think this would have just been passed easily, but it wasn't. But we're going to fight again for it. But so we support, if we get this passed in California, there's a saying that as California goes, so goes the nation.
Totally.
And when we look at the Canadian example, when the governor, he's called Premier in Canada, Tommy Douglas, he passed what they call Medicare, which is single payer.
Right.
He passed it in a province called Saskatchewan first. And all the other provinces saw how well it was doing in Saskatchewan, and then it became national program.
So the 20 people in Saskatchewan got the health care.
Saskatchewan kicks ass, man. I want to go there sometime, but they talk about leaders in a revolution, man. Those 20 people are some mighty 20
but that's what happens when you're rugged, like you're out and people in the rural areas tend to be way more like, I have just noticed, you notice now all around the world, like it's the rural people that are actually the ones that fight the hardest for human rights.
Well, and so interesting. And so all the same propaganda we see happening today, when they were taking it nationally in Canada, same propaganda. It's socialism, we're going to become, a terrible socialist country and all these things. But because it had already been passed in Saskatchewan and running, people could see with their own eyes, which is why the propaganda there didn't work. So our intention is, if we can pass it in California, it only helps the national Medicare for all efforts, because people then can see with their own eyes what is happening in California. Now, having said that, if another state passes it first, like our good friends up in Washington state, we're allies with whole Washington, or the great folks in Colorado or
Hawaii.
If any state passes it first, we at Healthcare for Us will be like, thank you. Like we love. So we're focused here in California. Other people are focused in their states. And then you have the people who are focused on the national level. So we feel that any state that passes it only helps that national figure.
We had a great opportunity at the beginning of the pandemic, at the end, when that Nancy Pelosi thing, I think Jimmy Dore was pushing that, like, we had this like great moment to really do something. And like all these like progressive people didn't do any, like they literally just disappeared. And it was like, wait, there's a pandemic. Like if you're gonna pass something, like this is the best time to do it, and nobody stepped up.
I love you for calling that out, Indy. You're exactly right. And so, this is where you talk about political hope. My hope is with the people, pushing them to make it happen. And for me, I like to go work on the smaller level, which for me is the state, because I feel like it's the smallest level where we could make that happen. Now, I know some people are definitely putting efforts to even smaller levels than that, say like county, and I am all for it. So, but we're all in the same fight together. But but healthcare for us is focused on the fight in California primarily,
Right.
with our love and support on the national fight. And
it makes me think of George Bush with his 1,000 points of light. 1,000 points of light. Wait, but really quick, love, before you go to the next thing, I do want to like, I would like this to be as succinct as possible.
Okay.
But like, what can you articulate for folks? What is single payer? Right? Like, how does that show up for a person? Like, how does that show up for a entrepreneur who is, you know, trying to start her business, and she's like, or how does it show, like, how does that show up for people, like a single payer?
Great. Why don't we just start with some basic definitions and break it down, and then get how it shows up for the entrepreneur. So basically, a single payer healthcare system is just where a single entity is responsible for collecting the funds that pay for healthcare on behalf of an entire population.
Okay.
That's just a basic definition.
So it's like what, like, it's like instead of having all these insurance companies, there's one company, let's say we call it Poo-Poo Doo-Doo.
Poo-Poo Doo-Doo. My favorite company.
Collects all the money, and it's not an insurance company now, right? It's not. It's kind of like that, but it's not.
So yeah, so you're definitely getting it. So in contrast, like what you're saying, a multi-payer system allows for multiple entities like insurance companies to collect that money to pay for those services. So, and then getting more specific to like what we're talking about, like when we say Medicare for all, CalCare, we're talking about, it's a single payer system that is publicly funded healthcare financing that pulls all healthcare dollars into a single government guaranteed trust. So it's important that this is a publicly funded.
Okay.
We don't want like, United Healthcare, a private insurance company, to be the only, that's not what we're talking about. We're talking about a publicly funded finance system that pulls all of our money. Let's just keep it to California since that's where we're at, right? Puts it in this government guarantee trust. And then basically you get a card, you go to any doctor, and it's the government that pays the bill. So what this is, it's a financing system. We're just talking about who pays the bill. It's publicly funded, privately delivered. So, your doctor is still there.
Everything is still there.
You'll go to Kaiser. It's just that instead of the insurance company paying a little piece of the bill and you paying the rest out of your pocket, the bill is paid for by the government. The doctor gets his bill.
You're talking about those millions upon billions of dollars that they spend subsidizing oil companies, subsidizing weapons companies, subsidizing blah, blah, blah. They
insurance companies.
Subsidizing insurance companies. They could be actually spending that on the people who need healthcare. Oh.
Yes. And let me give you an interesting story. So I have seen the same dermatologist in Los Angeles. I mean, I don't know, for 20 years, a long time. A little less than a year ago, and I have PPO insurance. It's supposedly the best. About a year ago, I got a letter. My dermatologist that I've seen forever, that I have a relationship with, that my husband's seen, that my kids have seen, is no longer accepting private health insurance. She's only seeing Medicare patients.
Wow.
And you can pay out of pocket to see her. When I talked with her more about that, Medicare paid at an equal rate. In some cases, these doctors are getting an equal amount, or in some cases, even higher amount than she was getting reimbursed by the insurance companies.
Wow.
And she gets the check right away from the government. With the insurance companies, she had to pay an office worker about $90,000 a year to fight to get paid, and was either getting paid the same, and like the checks were coming like 3 weeks, a month late. So she was done with it. So again, these doctors through CalCare, Medicare for all, they benefit in so many ways, mostly getting their dignity restored and being able to practice medicine. If you think about it, our health insurance companies are practicing medicine without a license because they go in there and tell the doctors what they can and cannot do. And I think that that from medical school. I have another great story I can tell about that, but I also want to turn it back over to you to keep us back on track. But that's the difference between single payer and multi-payer. And what we're talking about with Medicare for All, CalCare, is a publicly funded, government guaranteed trust that pulls our money and that then pays for the bills, publicly funded, privately delivered.
It doesn't create a system where basically what you're trying to say is that, like, if you do need a very serious medical, like medical treatment, right? You get injured, you get whatever, you break your arm, there is no worry there that it's going to be taken care of and you're gonna have to pay a bill later on. Because there's some people don't
worry at all, no matter what it is, preventative care.
Wait, hold up. Put a pin in preventive care. I'm going to get to that one.
Yeah.
That's an interesting one.
Yes, you're right. You get hurt physically, dentally, eyes, vision, mentally. Mental health care is included in this.
Great.
You go to any provider, doctor, psychiatrist, whatever it is, any hospital, any clinic of your choice.
Nice.
There's no more in-network, out-of-network. When you need it, there's no bill coming.
So to put it into context for those folks out there that are entrepreneurs, or they want to start a company, or they have a company, that also would this single payer system also make it easier for people to bring on employees? Like, because right now that's a big I've had to face that also with businesses where, like, you want to hire people, but then you have to think about how you're going to pay for their insurance and include insurance in that. Does that not have to be a problem anymore as an entrepreneur?
That problem goes away with Medicare for All and CalCare because employers are no longer responsible for providing healthcare. Everybody already has it. And so you now have more money to put into your company, whether it's hiring employees or
resources,
investing or giving back to shareholders, marketing. So you have more of your money because you also have, also on the flip side, for the employee side, you mentioned your parents. Now there's no more deadlock, staying in a dead-end job just for the healthcare, which you're probably underfunded anyway because you have to pay so much out of pocket. You can leave a job that doesn't work. You can move to another community or to another, place if you need to. You're not locked into a job. And I think that benefits both employers and employees because as an employer, you want people who are working for you who want to be there working for you, right? And as an employee, as an individual, that's freedom, honey. You want to talk about being free? You're not free if you are, tied to something that, to pay your, to get healthcare.
By the way, I'm neither against or for the idea of capitalism or socialism. To me, they're like within, and they're like yin and yangs. They're happening all the time, all around us, all kinds of things. But like the idea of insurance competing, right? It makes sense, right? Like that these insurance companies, but I don't feel they compete anymore. It feels like they're in collusion, right? It feels like they're setting the tone. It's not like they're listening to the customers.
So it doesn't make sense. There is no need for these insurance companies.
It's not capitalistic. It's like something else.
So first of all, capitalism is a totally different conversation. And I'm personally not a fan of capitalism. I'm anti-capitalism, but that's just me speaking for myself. But whether you are for capitalism or not, what I would say is, great, this iPhone, I don't know if you can see it that I'm holding up, make a profit on it. Right. This shirt that I'm wearing, make a profit on it. Earrings, make a profit on it. Go
Right,
your
right.
like have your capitalism.
Totally.
There should not be profit made in certain areas, whether you're for capitalism or not. Healthcare and education are two big areas, because once you bring profit into the system,
Right.
it is no longer a human right. And insurance companies do not now and have not provided a service. They are not doctors.
Right.
They are not nurses. They provide nothing. All they do are middlemen that delay and deny. Their motto is delay, deny, hope you die. They
Yeah.
delay
Jeez.
your health care. And you know, as somebody who went through medical school, delayed care is denied care. You know, if you delay on something, it can become so much worse. And then they deny your care. And then if you happen to die, they keep all the money.
They keep the money. Yeah. I mean, I would even propose too that the system that we have currently in the United States, it also drives doctors and nurses and healthcare providers to be less of healers. Like there's a, like, yeah, there are people who fall through the cracks and they are legitimately still healers, but it really drives incentive for them to be pill pushers, for them to be looking at the bottom dollar, to follow what the management and administration wants, right? Otherwise they're going to lose their jobs. I mean, so you do see a normalization of this profit within the doctors and nurses as well, right? It's
absolutely 100%. And you're seeing, like, you know, being a doctor, being a nurse was a profession, and you're seeing that now they're just employees answering to this boss. So there's a wonderful doctor. He's a pulmonologist who works with us a lot. And he's talked publicly about this story. So I'm pretty sure it's okay to say his name. His name is Dr. Richard Wynn. We love him so much. But he told this story that I think about a lot. And I never realized this. He said, you know, that number that you call like on your health insurance card when you need to ask them a question? He said that's the same number he has to call. There's no special number for doctors. That's the same number he calls to get a treatment, a procedure, a medicine, a test approved for a patient.
And those people that you call are never jolly. Like they're never happy on the other line.
So however long you're on hold for, he's on hold for the same. So he told, and then he told this story about how he had this patient, and I'm not good with medical terms, but remember, this is very specific what he does. He's a pulmonologist. Right. This patient needed this procedure, and he said he has to fight for them to get whatever it was that he needed. I think it was actually, you know, I don't know if it was a procedure or medication, but he had to call and fight for it on hold, 20 minutes, you know, whatever it is.
This is, by the way, time that he could have been spending on other patients, on planning for this, whatever. Yeah.
It gets denied. He has to then spend more time appealing. And then he explained, and he said, you know, the people who denied his claim is a retired doctor who's not even presently working in the field.
Wow.
Like long time ago retired, who's never worked with his patient. And he said, you know, I remember him saying, I went to medical school. It is so degrading for his judgment, for his expertise to be denied out of hand, for him to have to pretty much grovel to get what his patient needs. Yeah. And I can guarantee you the amount of time that Dr. Wynn spent on fighting for this patient, most doctors are not doing. Probably
not just doing it, but they experience it they experience it one time and they're like, I forget this. I'm not going to deal with this anymore, you know, or whatever.
What a horrible waste of time. And think about how long that process took and how long that patient was denied what that patient needed from what her specialist is telling her. This is what insurance companies do. We don't need them. CalCare, Medicare for all, single payer gets rid of the insurance companies. And it also brings the hospital budgets under control, because right now we have no regulations in hospitals of what things cost. So you can go to one hospital and they'll charge you $40 for a Band-Aid, and another hospital, they're going to charge you $100 for a Band-Aid. And it's all profit for them. You can't get an itemized bill because insurance companies and hospitals and pharmaceutical companies, they are all colluding to keep prices high, because when an insurance company is like gets, reimbursed, let's say, 80% of a bill from like somebody that's on Medicaid, well, it's to their benefit that that bill be as high as possible, or let's just say 20%, because 20% of 100,000 is more money than in their pocket than 20% of 10,000.
Right.
And so what single payer does is it brings in cost containment.
Right.
From in hospitals and institutions. It takes the profit out, which restores actually money being spent on the care for the patient,
right.
Allowing doctors and nurses and healthcare providers to do what they are trained to do, to make decisions with their patients, to spend time with their patients.
Right. I mean, I would even put it this way too. I'm a big game person. I love video games and this game, Dungeons and Dragons, like all that stuff.
You and my 14-year-old, the video games.
And like one of the things that's really important with like games, right, and game playing is like, and our social system is a game, right? A lot, and that these insurance companies and pharmaceutical companies, a lot of these organizations, they actually learn how to play they learn the rules of the game, and they learn where they can kind of bend them and stretch them, right? And one of the things that like people need to understand is that when you have this kind of single payer thing, it almost is like you're now like bringing the game, all the game is on one table now, right? And then you also can like have regulators, like the game regulators are able to like focus more on making sure there's nobody cheating in the game. There's nobody taking advantage, right? And so put that pin on the side. I do want to ask this question of you because I feel like a big problem in this space. Like, I mean, this is me showing up to these nurse, strikes and healthcare strikes. I've watched and participated as well in different spaces, and I notice there is an opportunity, right? There is a great division, but there's a wonderful opportunity right now where you have a bunch of, I'm going to say anti-vax, but you have people who are very critical of the pharmaceutical industrial complex, right now. Forget the word anti-vax, but there's now people who are not anti-vax who are also very critical, because there's been a lot of bad behavior the past few years, right? That are literally losing lawsuits. And as we're learning more and more, some of the problems we've been facing the past couple of years has been the really bad actions through the pharmaceutical industry and the medical industry and the insurance industry. So there's a bunch of people right now who are really not for this industry. Then there's this single payer people who, right, there's like your community, right, that's interested. There's a wonderful opportunity to build bridges and work together. And I think the bridge that I'm proposing in a hopeful way, and I'm curious what your thoughts are on this, on the preventative space, about pushing for this single payer. Like, what if this single payer perspective was also pushing for more support for yoga teachers to get paid to bring it into communities, more support, more money going towards acupuncturists, Ayurveda, all these different things, because that's all these communities, like, they don't get supported by this insurance industry. But if they were supported by the single payer thing, I guarantee you they would show up to these protests or to these rallies that you guys do, because hey, they want to survive too, right?
So absolutely. And there is a bridge here. And the reason why you are seeing, I think that the reason why people doubt the vaccines is because, well, first of all, there's two things here. One is we have a history in this country of medical apartheid,
Mm.
where people in communities, particularly Black communities, have been experimented on.
Literally.
So you can understand the hesitancy. And, although single payer addresses a lot of issues, we still have this medical apartheid issue to address. But single pay, first of all, getting everybody in the same healthcare system, meaning like you, Indy, have the same exact healthcare as Governor Newsom has. Because once we are all in the same system, we begin to massively address inequities, and we still need to focus on the racism, that some of our healthcare professionals are still holding within themselves. But so that's one reason. But the other why there is doubt against, vaccines, but the other reason is because because you have profit introduced. And this is why I keep emphasizing single payer takes the profit out of healthcare, and it will restore trust. Having pharmaceutical companies come up with, drugs or price drugs or vaccines,
like diabetic drugs, they like charge people like thousands of dollars, can't afford it.
Profit, understandably, creates doubt in people's minds. And so that's another area where having single payer Medicare for all, it's another issue that takes away. We can start to restore trust, and people can start to have faith in things, and they are still at liberty to make decisions for themselves in a single payer system. But I think you'll see faith restored in, healthcare services. Now, going to acupuncture and some of the non-Western healing practices, on our website, which you have behind you, which our website is hc4us.org. Scroll back up to the top, Indy. Yeah. So there is single payer, which you clicked, and then there's going to be CalCare. And you don't have to click through it now, but you click through CalCare. There's another button called Resource. There actually, yes, click CalCare, scroll to the bottom, and you're going to see, do you see where it says like CalCare bill text? Okay. That's the actual bill text. You don't want to open it because it's just going to be a lot of work, but it is the whole text. So you can see the bill is written. Indy, if you were to scroll to it, you will find that CalCare covers things like rehabilitation, massage, acupuncture. I don't know specifically about Ayurvedic, but they are covering.
But it's steps. It's taking steps.
A chiropractor covers chiropractor.
Wow.
So it's covering some of these non-Western wonderful healing practices. So I'm just pointing out, there's the text. You can find it in there. And then the other thing that I want to say now, Indy, think about if you go to your eye doctor appointment, your hearing appointment, your annual checkup, and all of that's paid for. Well, guess what? You have more money to then pay out of pocket for an Ayurvedic healer.
That's true.
So even if that's not specifically in there, it still helps people being able to access the services because you have more money in your pocket. And then hopefully we will work to expand to include more of these wonderful practices.
Yeah, I mean, it certainly does create a more of an incentive for the doctors and the healthcare providers to also start to explore and encourage their patients to be preventative, because there's not incentive model isn't profit, and we need people to be sick and keep coming in sick, but it's like, oh, actually we want them not to come, we want them to be healthy, we want them to be preventatively healthy so they don't even get sick, right?
That's right.
At this moment right now, it's like the system is built around people getting, like, it makes everybody makes more money if people keep coming in sick.
That's right.
That's
And right
insane.
now with the profit incentive, right? So if the if the institution that you're at, if they're going to make money on giving you an MRI that you don't need, they're going to recommend an MRI that you don't need, which is not necessarily healthy for you. I've talked with people and they're like, I have great insurance. Every time I go in, I get an MRI. And it's like, and they think that they're getting top healthcare. And what I wanted to, that's not necessarily good care, because every time you go in for like, if you don't need a procedure, you really shouldn't get it. Right.
No.
But so if they're going to make money on giving you something you don't need, they're going to recommend you get it. If they're going to make money denying something you need, we're not going to get it. So whether you think you have good health insurance, getting all these MRIs, or it's just bad. Having profit in the system doesn't work. We have to take profit out of the system. And that's what it does. Have profit in the iPhone system, have profit in the, laptop system, but not.
Or check out some of the prophets out there who have done some great work in the world. Those prophets are good. So curiously, and are you okay with going a little bit over the hour?
I'm totally okay.
Okay. So I'm curious. So one of the things I love to do with this podcast is to kind of explore the glass ceiling, right? Because it is a wonderful space for us to explore hope in that way too. Is sometimes we have to visualize and talk about what could happen for it to happen. Like what if, right? What if that's the case? So curiously, and maybe you can answer this both ways, Erika, because there's also Erika, there's you and what you do in the world and so like in 3 years, let's put that out there, 3 years from now, what's the glass ceiling for what the individual Erika is doing in this space and in your space and whatever in your life? And in 3 years, what's the glass ceiling for this cause? For HC for us? Like what's happened? Like what's in 3 years? What's happened? Like glass ceiling.
Okay. This is so much fun. Thank you for this. Okay, let's dream together. So here's what it looks like. The nurses, CNA, they put forth CalCare in January. We pass CalCare. Immediately, it goes through, we pass it, we get it implemented in the state of California within a year. And then within the next year, we pass all across the nation, Medicare for all. So that's year number 2. You said I got 3 years. Okay. So that's, and so that's it. Like we pass it. So what happens is healthcare for us, dismantles, we fold, because we're like, mission accomplished. We got it in California. We got it for the nation. Good job, everybody. We're done. And you
guys are going to become like an institutional nonprofit that sticks around fundraising for
No, we fold, or maybe we just keep our website up for information, or maybe we stay as a watchdog to make sure nobody undoes it. But other than that, no, we completely fold, mission accomplished. So let's go with that. We fold. And where that leaves me is, well, I'm happy, joyous, and free, because I'm knowing that my family, my children, my future grandchildren, my people just in every area, they're getting physical healthcare, mental healthcare, everything. And so then I think what I do personally is then I'm full, like my full activism time is spent with white people for Black Lives, allying with Black Lives Matter, Los Angeles, and continuing to fight for human rights, such as, reimagining our, like I like to say right now, it's a criminal injustice system, but taking, defunding the police and refunding the community, having more resources for housing and
education,
youth programs, and just you name it, and reimagining, and more of an abolition society that we live in, where we have alternatives to the current, unjust prison industrial complex. So yeah, so that's where I go. I complete this, and because right now my activism time is split.
Right.
And yeah, I'd like to just get this accomplished and go there. That's my 3 years.
It's great. I mean, that's a great glass ceiling, and actually it's very accomplishable. Like it doesn't seem like it is too far out there actually from happening. And that makes me also contemplate in you sharing that is how both of the things that you care about and you put your, and I do have to commend you, Erika, for choosing 2 causes to be an activist about that are actually very interwoven, right? These are very, very interwoven, and healthcare being a human right, but also how it actually prevents so many Black and brown and people of color from being able to advance because they have to take up jobs or they have to do things that doesn't really allow them to heal from generational trauma or to be able to grow in their communities. Because wow, I can't tell you how I volunteered in Skid Row so much. And I met so many people on those streets that literally it was like a medical situation that ended up leaving them there. Like it was a medical bill.
Absolutely.
And it was like, whoa, like I can't believe it could be any one of us. It could be, but it was so many Black and brown brothers and sisters that like, they just didn't have the infrastructure, the community structure to support them after they went through a medical procedure they couldn't afford.
Yeah, we're the only country that has people declaring medical bankruptcy. I mean, and if you look at, much of our unhoused are there because the father got a brain tumor and the bills, they're living in their car now because they can't pay rent. It is outrageous what we pay in this country for healthcare, for medication. And no, these other countries, Canada, France, Italy, the Netherlands, you name it, they don't have this experience. We have in this country, we have a caste healthcare system. It is classist, it is racist, and it is cruel.
Yeah.
We have a cruel system, and single payer healthcare, Medicare for all, CalCare ends this caste system. And when separate is never equal. And as long as there is a tiered system where this group gets platinum care and this group, they get bronze care, that will never, ever work. We have to all be in the same system. Like I said, where our unhoused brother and sister gets the very same comprehensive, high quality healthcare that the governor and his children get.
That's a great message. And I also encourage, as we wind down with this conversation, I also encourage you, and this conversation came up, but it would be great to explore this. And I would love to jump in however I can, but in creating that bridge for the people out there who are never, before they weren't, but now they're very, very critical of the healthcare system here in America, how to bring them into this space. Because there's a lot of people who are incredibly critical about this space, but they don't know that the single payer thing could actually be a solution for their criticism of the medical industrial system. Right?
You are so brilliant to just make that connection. And you're absolutely right. And the reason why they haven't seen that connection is because the propaganda, right, is so ripe. But really, the people united will never be divided. And if we can unite with people, like you're saying, that have these criticisms, and they can cut through the propaganda and see how this actually answers their criticisms, how this actually restores us to having a health care system instead of a health insurance system. You are exactly right. And I just want to say, like, before we close, to help make my dream come true, our dream come true, that you let me share, please come to our website because and start reading, because we have great resources. It breaks down what is single payer, what is CalCare, like there's the bill there. We have we link right to the nurses toolkit. So like right now they're calling for district leaders in the ramp up to the introduction of CalCare. So you can just go on our website, explore on our website, click single payer / Medicare for all, then you can click CalCare and then click on our resources page. And just, we have, you know, there are letters you can send in right now telling your California legislature to sign the nurses pledge. So there are things we can do in the ramp up. They're at our website.
Go to their town halls. Like if there's a state delegate running for, go show up physically to their town halls and be like, hey, are you gonna, you know, are you gonna support this?
Are you gonna sign on to CalCare? We want CalCare. So go to hc4us.org, check it out. And join, and we have an email address. If you are critical of the system, if you are critical of single payer, contact us. We want to talk to you. Let's have a conversation about it. You know, let's build outside of our choir. And then if you got $5 to put on it, please contribute.
Do you accept Bitcoin or Ethereum?
No, we're not that advanced.
You should set that up right there, you know.
I know, we should definitely look into it. So, but we are all volunteers. So I'm a mom with a kid in high school and middle school. Maureen, my co-chair, is a grandmother. Our major tech gal, Bronwyn, you know, is working. But so we're all volunteers. So we're very kind of slow at getting to things and doing things piecemeal. But and speaking of, I just want to give a shout out to all of our volunteers that make up our board. I can't shout out everyone by their names, but I love you all, every single one of you. The pieces that you do, even though some of them may seem small, some of you are doing bigger pieces, we're all doing what we can when we can, and you are making this happen, and we don't have this without you. So much love to you, board members, committee leaders, volunteers. So yeah, join us. We need volunteers, contribute, educate yourself, spread, you know, share the website. You can follow us on social media. We're at HC4US and then _ORG on, you know, Twitter, TikTok, Instagram.
Yeah, that's actually how I came across you guys on social media. And I loved your guys' messaging on social media. It was very, it's hip.
Thank you. That's Bronwyn and our social media team.
It's important. You got to be hip these days, you know, otherwise people can't focus. Even if it's for their own good.
So all the young hip people, come and join us.
But yeah, thank you. And you know, I do appreciate you taking the time for this, and let's see what happens. Obviously our attention is very powerful. So the more attention we put to things like this, and it can only work out, you know? So, so thank you so much, Erika. I really appreciate you. Wonderful. Thank you.